Welcome back to A Good Pour. I'm Kathryn Good, your host, and today we have Jenny Dittes with Hope Family Health, or just plain Hope, which I just love because right from the get-go we are spreading something we all need in hope. But welcome, Jenny. I'm so glad you're here.
Thank you. It's fantastic to be here.
Would you tell everyone a little bit about Hope Family Health?
Sure, I'd be glad to. So Hope Family Health opened in 2005 in a little double-wide trailer in Macon County, so just about 30 miles north of Gallatin or so. And we opened with the mission of providing different kind of health care, really health care for everyone that needed it, regardless of insurance status or ability to pay. And it was an interesting story because before we opened, I had been in private practice. I'm a physician assistant, family practice PA, and had been working in the Westmoreland area for several years by then, and noticed that a lot of patients couldn't receive health care because they didn't have insurance, or sometimes they just didn't have the money to pay. And so, and the other thing that tends to happen in private practice is it's all about the number of patients you can see. So as providers, we're pushed to see a lot of patients in one day. And I didn't feel that was the best kind of healthcare. And so gradually this vision started to grow for me. And it was a vision of a different kind of healthcare facility, a healthcare facility that really could focus on the needs of the patient and that didn't restrict care based on things that, were beyond a person's control. It was a dark time in my life. My husband and I were both out of work at the time. We had 3 small children. The youngest was only a year old, and we were living off credit cards. And it was at that time that God called me to open this new place called Hope. And it truly was a leap of faith. One of the hardest things I've ever done, also one of the best.
Absolutely. Yeah. Tell me about Westmoreland. And I did visit the facility in Leadership Summer. I guess it was probably 2017. So it's changed a lot since then. You have a brand new location too in Gallatin. But talk about Westmoreland and why Westmoreland. Why was it important to put it there?
Sure. So, they say grow where you're planted. And when my family moved to Portland in the year 2000, after doing some aid work overseas, we moved to Portland and I got a job in Westmoreland in private practice there. But, I love small towns. I grew up in a small town and I've done all of my work as a medical provider in small towns. And so it really felt very comfortable for me to be in a small town. And Westmoreland is, it's a really unique little place. It's growing quickly, but the actual population is somewhere around 2,000 people of Westmoreland itself. I love the people, just fell in love with the folks there. And as you get to know it better, you realize that there are so many people that are really struggling and that are struggling in every area of their lives. And so, and in fact, just being here in Gallatin or Hendersonville, it's really even just driving, 30 minutes north, it's really a different place.
Absolutely.
If you look at the socioeconomic status, the health indicators, all of the different statistics, Westmoreland is really struggling in a way that Gallatin and Hendersonville are not. And so it's just there are a lot of good people there and a lot of folks that I think need an opportunity to be able to just rise to the next level in their life, and providing healthcare is part of that.
Yeah, I'm glad you said that. That's what struck me was just 30 minutes away
Yes.
It's much different. And we're just, a lot of times we kind of go about our life and aren't aware really
Yes.
of just differences within our own county. Yeah. Talk a little bit about, our bodies are a temple and we need to take care of them. And just how you can see being well or unhealthy can just impact the rest of your life.
I love that question. Thank you for asking that question. When I first started in Westmoreland at Hope, one thing I noticed was a lot of my patients were dying way too young. And I'm talking about in their 50s or 60s. And after a while, back then we had paper charts. Now we have electronic health record, but we had paper charts at the time. And I just started to put, every time that I lost a patient, that a patient of mine passed away, I would just take a cardboard box and put the chart into the cardboard box. And after a couple of years, I did a very unscientific study of those charts. I just looked back through, I had 30-some charts, and looked at what had happened for those folks. Why had we lost them? And, so many of those deaths that were way too young, and the average age of death was like 57. Wow. Way too young. But a lot of those deaths were what I call diseases of hopelessness, substance use, overdose, either intentional or unintentional, suicide, people who had very unhealthy lifestyles and then, developed cardiovascular disease too young and passed from a stroke or a heart attack. And of course, there are so many things we can do to prevent those. And so cancer, of course, but many risk factors were there that were preventable. And so, a huge question in my life, in my career, has been, how do we prevent those? And I still don't have all the answers, but I do think it depends on the culture that we create. It depends on each of us making good choices. It depends on educating people. At Hope, one of the biggest parts of our mission has been to gradually expand our influence and our ability to influence those risk factors for our patients. And so, just for anyone listening right now, I would say, yes, your body is your temple. And I heard a quote that I love, and it is, take good care of your body. If you don't, where else will you live? Wow. And it struck me because it's true, at least our consciousness, the person that we are, it depends on us having a body, that is healthy. And so,
we can't do good work if we're not healthy, right?
Exactly. So take care of that body. It's important.
Yeah. Well, speaking of good work, you clearly do it every day. But when you think of a good day, what does that look like for you?
Yeah. So you are asking very good questions. Kind of think on that. I think a good day is a day when I can make a difference. There was a big study that came out. It was called the Men's Harvard Health Study. You may have seen it. And it's what they did, the researchers actually started like 80 years ago. And they took a group of almost 1,000 students from Harvard. All of them were men. I think at that time, Harvard only accepted men. They interviewed all of them, and they looked at like multiple factors in their lives, health and social, connections, and just many, many different things. And they continued to interview them periodically throughout the rest of their lives. And this study lasted more than 70 years. It was just concluded recently. And so, of course, they were looking at what constitutes a good life, what constitutes a successful life, what are the factors there. And the lead authors of the study came back to the one thing that stood out more than anything else was really good relationships, good, positive social connections, having people in your life that you love and that love you. And in fact, the lead author was quoted as saying, it comes down to one word, and that is love. And he then quickly followed up by saying, I'm a scientist, and in my line of work, I know that I may get criticized for saying that because love is such a nebulous concept. But he said that really is what it came down to in this study. And so I think that's so important. And for me, a good day is a day that involves connection with people, connections in which I can brighten their day in some way, make their life better in some way, a day in which I can find new ways of showing love to the people that I care about, and just to really, a day that will strengthen those connections.
Love that. What would you like people to know about Hope and just kind of healthcare today?
Yeah. So, first of all, in terms of healthcare today, our healthcare system has never been this reliant on technology. And that's a good thing, but that also there can be a dark side to that. It's good because it makes us much more efficient, and it allows us to track, the statistics in terms, it's easier now to make sure that all of our patients are up to date on their mammograms and their cholesterol screenings and all their other screenings, because that is automated within our system. And we also can track health indicators so much more easily and create interventions that will that are based upon a lot of data, and that's all due to our electronic health record. But what we tend to lose with that is, again, that personal connection. And so what I'd love for folks to know, I think, about the healthcare system is that the healthcare system in our country is honestly struggling a little bit. COVID was a harsh blow. There are many people that left the field of healthcare, and those of us in healthcare, many of us are still struggling with the whole electronic thing, like how to really have those good interactions while also utilizing technology.
Right.
And so, healthcare, it's made up of many, many people that are doing the best they can, but also, the healthcare system is struggling and in many ways broken. And so I don't have all the answers, but I can tell you that for me, a lot of those answers came by creating this place called Hope Family Health. And within our walls, my goal is to create that place of safety, to create a place of psychological safety where people can come, and that we create that environment where healing can take place. And healing is so much more than physical health. A lot of healing also has to do with our outlook, whether or not we have hope in our life, whether or not we have good things to look forward to in our lives, whether or not we have the belief that our lives can get better. Those are all important. And of course, our connections. Who do we have in our lives that can walk next to us? And so at Hope, we really seek to do that. We seek to walk next to people. They're in that lead role or that driver's seat in terms of their health, but we are there to help them and walk next to them, to advise them, and to open up doors for them in terms of controlling their health and becoming healthier. And so it's all about potential. Our potential as human beings, part of that depends upon our ability to take control of our health. And we do really believe in taking care of that whole person. So we offer primary care. We offer integrated behavioral health, which means that a person can come to one of our offices and see their primary care provider, but also during that visit, if they're having a behavioral health issue, if they're depressed, if they're going through a difficult life event like a divorce, or if they've just been released from, being incarcerated, or anything else that is stressful, then they can also see a mental health provider and get established for that type of care within the same facility. We also have a pharmacy on site. We believe that access to affordable medication is a big part of getting healthy. So we provide that. We do bilingual navigation to make sure that patients whose first language is not English are comfortable and can understand our providers. And we do refer for dental as well. We have a partner that provides dental care. So we really do try to surround people with care and to create that environment where they are empowered to achieve their very best health outcomes.
Absolutely. Healthcare can be intimidating.
Yeah.
It's always scary when you start to think something's wrong.
Yes.
And so it's scary to walk in the door. It's scary sometimes to know what they're going to say. And so you are providing that safe space and that relationship that they can start to let go of some of that fear and have hope, right? So you get to do that every day. So my question for you is, how do you take care of you so that you can then help other people have hope and really make good of their life? How do you take care of you?
Yeah, such a good question. So it is very important to take care of ourselves, and not just in healthcare, but in absolutely every field. And so, any walk of life. And I did learn that the hard way. I did burn out. I've burned out several times in my career, of course, trying to take care of everybody else and trying to create this space, this organization. And so I did learn the hard way that I had to take care of me, and that it's not selfish to take care of yourself. It's actually the best thing you can do for those people who depend upon you. I'll just go back to 2022. We were still in the pandemic, and the pandemic was absolutely like a pressure cooker for those of us in healthcare. It was stressful for everybody, but I think especially for those in healthcare, it was very, very hard. We were losing people. We were trying to treat this illness that we didn't know how to treat, and people were dying. Our patients were dying, and there were a lot of, I guess, opinions out there about whether this was even real. And then we were losing patients, and it was a tough time. And so it was stressful. During that time in 2022, I also went through a divorce and experienced the empty nest. All three of my children at that point were out of the home and going on to launch their own lives. So it's just really, it was a tough time. And I asked myself the question, what do I long to do? And the answer was, I really want to go on a backpacking trip. So I did a 1-month backpacking trip. I did the whole Colorado Trail, which is a 486-mile footpath from Denver to Durango, and did it by myself. And it was honestly one of the most beautiful experiences that I've ever had. It was a chance for healing. It was a chance for reconnection. It was a chance to just to reconnect with God, with myself, with my sense of purpose. And when I came back, and it would be honestly a whole other podcast
Sure.
to tell about that trip. But I'll just say that when I came back, I had a new sense of purpose. And I came back to my own life with this gratitude that I had not had before. And so I would say that in taking care of ourselves, whatever that means for you, but I would encourage everybody, don't wait to do the things that really matter. And whether that's just taking a week off to completely reorganize your kitchen, or, for some people that may be very fulfilling, or doing a long through hike over 30 days, or, it could be something much simpler than that, just taking a day off to take your mother out to lunch, or whatever that means. I love the question, what do you long to do?
I do too. Sometimes it's God trying to get us to obey, right?
Absolutely.
Sometimes it is something that is keeping us up at night that we just can't let go of and we need to get done so that mental space is clear.
Right.
Sometimes it's a dream that we just haven't. I love it. I love that phrase of what do you long to do? Mm-hmm. So I think that will be something to remember from this podcast for sure.
Well, can I ask you how you would answer that question?
Right now, currently, this is the other reason I love this question is because it can change seasonally.
Absolutely.
And, I'm gonna start crying. So my son's going to be a senior, and I'm taking how to have a 4-day work week. And I'm answering the question the same is I want to enjoy that time. So
that's beautiful.
That's all. I can't talk about it anymore.
Thank you for sharing that. And I can relate because I also have recently gone through that phase of my life. And for many, I'm going to say this is kind of embarrassing to admit, but like for a year and a half or so, I could not walk past my daughter's bedroom door without tearing up. Mm-hmm. And it's hard for us as mothers because we create that whole space just for them, and then they're not there. So what do you do with that space? And it's important, I think, for us, and I realize this is maybe a little tangent, but maybe not. But for those that may be listening that are mothers or parents who are approaching that part of their life, I do think, because I'm a little further through that than you are, but treasure them. Do whatever, that means to you, and also find some other things that give your life meaning.
Yeah.
And but there's nothing easy about that.
Well, and I mean, they're not going anywhere, right? During this filming, we actually have 2 college students with us helping DJ behind the scenes. But the best parts of my relationship with my parents were right after college, when we traveled. Before I had kids, I was newly married.
Right.
And there's just something about kind of being an adult with your parents that was, and I look forward to that with my own kids. But it's just like this, we had, almost 18 years of family dinners and family vacations. And now, all those things can still exist, but they look much differently than
They just look different. Yeah. They're transformed. It's, the very same love, the very same relationship, but in a different form.
That's right. Yeah. So I'm actually very proud of him and excited, but it's still just, I just want to make the most of this year. So
totally good.
So, but thank you for asking.
Absolutely.
Anything else you would like anyone to know about Hope, or how they can support Hope, or you're just a treasure to this community? We're also in Together Sumner together and working on just making sure everyone feels loved in this community. So anything else you'd like to share today?
Well, we have just opened an office in Gallatin, our newest office, and that is right next to Sumner Regional Hospital on Steam Plant Road. It's in the medical office building there, and so we're there. We are still getting established, but that office is getting busy. If there's anyone that is interested in that type of holistic care, where we can provide the medical, and we can also do the behavioral health kind of in that same setting. And we can take care of you if you're uninsured. We do have a sliding fee scale. And we can also take care of folks that are insured with Medicare, TennCare, or we take almost every insurance as well. So, that's probably the last thing that I would like to say, is that we would love to be of service, and we would love to just be available, be a resource for the community.
Great. Well, thank you for the good work you do. Thank you for being here today, and thank you for spreading hope. We need it in all areas, and especially with our health. So thank you.
It was my pleasure. Thank you, Kathryn.